We're going to do what's called a fundoscopic exam, which basically means we're going to shine a light into your pupils, and we're going to look at the vein to artery ratio. We're going to see if there is a proper ratio there. If the brain on one side is not firing as good as it needs to fire, you're going to have a heightened sympathetic effect, and what that can create is it can create what we call venous ballottement, or can cause the arteries to be a different size than they need to be when we do a fundoscopic exam. We're also going to look at your eye movements. We're going to look at what's called convergence, and convergence means we're actually going to have you look at a pen and it gets close to your eyes, and we're going to see if your eyes move in the way they need to move in. Typically when there is either a bad function of the cortex on one side or a decreased function in the cerebellum, what will happen is the eye will come in and it will sort of bounce out. We call that an exophoria. It's because that side of the brain is fatiguing a bit faster. The other thing that we do is we do what's called a realized vestibular exam. And basically what we do is we put these goggles on. And in these goggles what will happen is there's a infrared camera. And what the infrared camera does is it videotapes your eye movements. Some eye movements happen so quick that they're kind of tough to look at just during a bedside exam. So what we'll do is actually videotape your eye movements, and we'll look and see, do you have proper eye movements? Sometimes what will happen is when a patient looks from one target to another target, they'll actually have a bouncing and they won't actually hit the target smoothly. They'll actually either pass the target or they'll stop at another target before they get to the actual target. That's called Saccade Testing. And we'll look at that. That is typically indicative of either a cerebellum not firing the way it needs to fire, or the frontal lobes not firing the way they need to fire, which is very important when it comes to the demand in certain areas in your brain. So the frontal lobes are key. The other thing that we're going to do is we're going to do what's called optokinetic testing. Optokinetic testing means what we're going to do is have you look at these red and white squares as we run your eyes across. And what should happen is the eyes should bounce as these red squares go across. It's called optokinetics. Patients that have decreased functioning of one of the hemispheres of their brain will have a lack of bouncing or decreased bouncing. So that's how we test the cortex. We do various other tests, but I won't go into those on this tape. The other thing that we want to do is we want to look at the cerebellum. Remember, the cerebellum is the back part of your brain. It controls your balance. It controls your coordinated movements. And that's a real important thing because, again, the cerebellum fires up to the brain, okay? And then the brain fires down to the lower brainstem. So you can have a problem in your cerebellum that creates a problem downstream, or down neuron, if you will, in the cortex, which eventually creates a lower brainstem that's not firing well, and that's going to affect the way your blood vessels dilate, again, causing migraine headaches. So again, we'll look at your cerebellum, and one thing we'll do is we'll have you close your eyes, and we'll have you do finger to nose. And the reason why we do finger to nose is because the cerebellum controls coordinated movement. So if we have nice, smooth finger to nose, that's a good sign. If a patient comes in and they have a little bit of a jerkiness as they come through, or some people miss, that's a sign of the cerebellum not working. We'll also look at smell. Smell is actually for the frontal lobes, but what we'll do is we'll see some patients will have decreased smell on one side of their nose versus the other side of their nose, and that's usually indicative of the brain not firing well. We'll do something called blind spot testing, which is to look at how well your peripheral vision is. Patients that have decreased firing of the right brain are going to have a peripheral vision problem on the left side. The cerebellum, we're going to look at rapid alternating movements, how smooth and coordinated your movements are. How smooth and coordinated are your movements when we do hand slap? When you stand with your eyes, with your feet together and your eyes closed, are you swaying to one side? That's called Romberg's test. It's a very important test for the cerebellum. So these are just a few of the tests that we do to determine which part of the brain, again, has that soft physiological lesion. That means that that part of the brain is just not doing its job. It's not as quick as it needs to be. It's not firing as well as it needs to be, which then creates a host of different symptoms, migraines being one of those. Biomechanically, what we want to do is we want to take some x-rays of your spine, look at any past MRIs you may have of your spine. Again, patients with tension headaches tend to have misaligned spinal vertebrae. Cervicogenic headache, meaning the headache is coming from the cervical spine. We want to look and see, is the curve, the normal structure in your neck, is that where it needs to be? So we're going to take some x-rays and look at that. We want to see, is there any arthritis in your neck? Okay? And if you look at the x-rays that I'm putting up right now, that the x-ray on the left, you can see that that patient does not have a good curve in their neck. They should have a curve along that black curve line, and you can tell that they're not in that normal position. This patient had tension headaches. And you can see to the right, that's the correction that we did through specific biomechanical exercises and specific types of gentle chiropractic adjustments. We restored that arc into that person's neck, and that patient doesn't have migraine headaches. It doesn't have rather tension headaches anymore. And patients with migraine headaches typically also have biomechanical problems. The other thing that we want to do is we want to look at you metabolically. Now, what do I mean by metabolically? Well, we want to look at your blood work, and we want to look at your blood work through a preventative medicine perspective. We want to look at your adrenal glands. We want to look at your thyroid. We want to look at your glucose levels. Some patients with migraine headaches have hypoglycemia, and they're just never going to get better with the migraines until we balance out their blood sugar. Some people have pre-diabetes or insulin resistance. So again, we want to take a look at that. A lot of patients with chronic pain or migraines, their adrenal glands are shocked. So we want to do what's called an adrenal stress indices or an adrenal stress index. And what we do with the adrenal stress index is we're going to actually have you, it's a salivary test, so over about 2 or 3 days we'll have you put your saliva in this little container. We send this off down to a lab down in Texas, and they'll give us a good understanding of how your cortisol rhythm is going, how your DHEA is working, how your progesterone is working, and it'll let us know if there's any troubles with your adrenal glands secreting too much cortisol, too little cortisol, and again, that can stimulate headaches. So we want to look at you metabolically. The other thing that we do is we want to look at you hormonally, and that's particularly with female patients. We want to look at what we call your female hormone panel, and that's a 30-day salivary test where we're looking at estrogen and progesterone levels, and we're determining whether those things are smoothly balanced through a 30-day cycle. If they're not, we want to address these things metabolically. So we take all that information from your metabolic panel, your blood work, any salivary tests that we do, and then we'll spit you out put it into a computer, and it actually prints out a specific report that's specific for your particular blood findings. And we'll also give you a specific diet and specific dietary supplements that are going to help you heal better. Okay? Now, let's talk a little bit about the treatments that we do. Basically, when you're dealing with the nervous system, when you're trying to get the nervous system to function better, when you're trying to get that lower brainstem to fire a little bit better, the brain needs fuel and it needs activation. Okay? Nerves need that to be happy. So, fuel, let's talk about that first. Fuel comes in two forms. It comes from the foods that we eat. That's why we do the metabolic testing. Glucose levels. The brain needs glucose. The other thing is oxygen. The brain needs oxygen. And activation is the specific stimulations that we do. I'm going to talk about those in a minute. But let's go back to fuel. One thing that we do in our office with almost all of our patients with migraines and headaches, tension headaches, is we put them on oxygen therapy. And the reason why we put them on oxygen therapy is because oxygen is vital for the brain and nervous system, for the health of the brain and nervous system.